Good morning, ladies and gentlemen. Batch 2022. Today we have another lectures on community oral health, which we call health-related quality of life. What is you consider as quality of life? What is quality of life? Quality of life we can consider as the degree to which an individual is healthy, comfortable, and able to participate in or enjoy life events. The term quality of life is inherently ambiguous as it can refer both to the experience an individual has of his or her own life and to the living conditions in which individuals find themselves. Hence, quality of life is highly subjective. Okay. Again, what is quality of life? Whereas one person may define quality of life according to wealth or satisfaction with life, another person may define it in terms of capabilities. Example, having the ability to live a good life in terms of emotional and physical well-being. A disabled person may report a high quality of life, whereas a healthy person who recently lost a job may report a low quality of life. Within the arena of healthcare, quality of life is viewed as multidimensional, encompassing emotional, physical, material, and social well-being. So, what is health-related quality of life? Life expectancy and causes of death have traditionally been used as key indicators of population health. While these indicators provide critical information about the health status of populations, they do not offer any information about the quality of the physical, mental, and social domains of life. When quality of life is considered in the context of health and disease, it is commonly referred to as health-related quality of life to differentiate it from other aspects of quality of life. Since health is a multidimensional concept, health-related quality of life is also multidimensional and incorporates domains related to physical, mental, and emotional and social functioning. Okay. Health-related quality of life goes beyond the direct measures of health and focuses on the quality of life consequences of health status. Another related concept to health-related quality of life is well-being. Measures of well-being typically assess the positive aspects of a person's life, such as positive emotions and life satisfactions. So we have this image of uh, quality of life and health-related quality of life. What do you consider as quality of life and health-related quality of life? Maybe your housing, your job satisfaction, perception of environment. We can consider that as health quality of life, but health-related quality of life where you have functioning person, social, emotional, physical, perception of her, spiritual, psychological satisfaction, life satisfaction, and satisfaction with health status and treatment outcomes. Okay. What is then the oral health related quality of life? Oral health related quality of life, or OHRQOL, is a part of health related quality of life that focuses on oral health and orofacial concerns. It describes the way in which oral health affects a person's ability to function, psychological status, social status, and pain or discomfort, as described by Inglehart M. and Beckerman, 2002. Okay. Oral health related quality of life. It refers to aspects of our health related quality of life that are more specific, which primarily focus around the orofacial regions and related concerns. One first aspect is the function of the oral region, that is chewing, speaking, speech, and swallowing. Second one is psychological aspects, the appearance, the self-esteem. The third one is the social aspects, communication, interactions, intimacy, and the last but not least is the pain and discomfort aspect, acute and chronic pain or discomfort. Okay, what is oral health related quality of life? This is a multi-dimensional construct that reflects, among other things, people's comfort when eating, sleeping, and engaging in social interaction, their self-esteem, and their satisfaction with respect to their oral health. The impact of oral health diseases. The impact of oral diseases and disorders on aspects of everyday life that a patient or person values that are of sufficient magnitude in terms of frequency, severity, or duration to affect their experience and perceptions of their life overall. How does health status affect quality of life? With disease, you have impairment, you have discomfort, you have pain, you may have disability, physical handicap, or psychological and social not well-being. We have a functional limitation on certain other aspects. Oral health related quality of life measures. Self-reports specifically pertaining to oral health, capturing both the pain, functional, social, and psychological impacts of oral disease. Second is the ultimate outcome measure of the oral health care system. Okay. Oral health quality of life measures. These measures, which were initially designated as social dental indicators or subjective oral health indicators, are now more usually referred to as measures of oral health related quality of life, based on the assumption that the functional and psychosocial impacts the document must or necessity affect the quality of life. Quantifying oral health. Clinical measures of oral health, perceptions of general and oral well-being, and reported physical, social, and psychological functioning are independent, but correlated components of overall oral health related quality of life. Domains of oral health related quality of life measures: opportunity, resilience, health perception, functional states, impairments, diseases, and duration of life. It addresses the trade-off between how long and how well people live. The health-related quality of life approach has provided greater opportunity for investigation of the interrelations among oral health, health, and related outcomes. The inclusion of patient-driven measures such as perception and functional status is critical. Benefits. An oral health-related quality of life approach benefits clinical practitioners in selecting treatment and monitoring patient outcomes, researchers in identifying determinants of health, tracking levels of health risk factors, and determining use of services in populations, and policymakers establishing program and institutional priorities, policies, and funding decisions. Uses of health-related quality of life measures: screening and monitoring for psychosocial problems in individual patient care, population surveys of perceived health problems, population surveys of perceived health problems, medical audits, outcome measures in health services or evaluation research, clinical trials, cost-utility analysis. How do we measure our health-related quality of life? The categories of health-related quality of life measures. Social indicators used to assess the effect of oral conditions at the community level. Days of restricted activity, work loss, and school absence. Global self-rating of oral health related quality of life. Single item ratings general quality about oral health. Multiple item questionnaires most widely used. Overview. Oral health related quality of life measures can be viewed as generic or generic general health, or specific. We have oral health related quality of life measures. Okay. Overview of oral health quality of life measures. You have oral health related quality of life measures. You have specific and you have general. For specific, you have disease or condition, example oral cancer, dental-facial anomaly, or you have oral hypertension, example dental anxiety, or you have specific population, example children. Alright, while in general health, you have overall oral health. Okay. General oral health related quality of life measures. Okay. General, example geriatric oral health assessment index. You have the GOHI, the Atchison and Dolan, by Atchison and Dolan in 1990. Number of items is 12, and the domains is chewing, eating, speech, social context, appearance, pain, worry, self-consciousness. For oral health impact profile, you have OHIP by SLADE and Spencer 1994. You have 49 and 14 items, which is considering the domains as function, pain, physical disability, psychological disability, and handicap. While oral health related quality of life by OHRQOL UK by McGrath and Beddy 2001, you have 16 items, that is eating, appearance, speech, health, relax, sleep, social, romance, smile, love, confidence, carefree, mood, work, finance, personality, comfort, and breathe. Another oral health related quality of life measures that we can measure is oral impacts on daily performance, OIDP, by Crescent et al. In 1997. There's 9 items which are considering the performance in eating, speaking, oral hygiene, sleeping, appearance, and emotion. Okay. Another measures. Child Oral Health Quality of Life Questionnaire. Okay, by Djokovic and Locker 2002. You have 36 items. It involves the oral symptoms, functional limitations, emotional well-being, and social well-being. Another one is this functional assessment, cancer therapy, head and neck modules. Okay. FACT and HNN version 4.0 by Siller and List 1996. You have 39 items. That is the physical, social, emotional, functional well-being, and head and neck concerns. Another one on child, that is child oral impacts on daily living, child OIDP by Gerumpong, Sakos, and Shehem 2004. They have 8 items. The main domains are functional, psychological, and social limitations. Another one is autonomic quality of life and questionnaire on oral quality or autonomic quality life by Cunningham et al. 2000. They have 22 items that involve the social aspects, facial aesthetics, oral function, awareness of dental-facial aesthetics. Okay. Applications of the measures: dental public health, oral and maxillofacial surgery, oral medicine, periodontology, oral rehabilitation, aesthetic dentistry, orthodontics, pediatric dentistry. And the limitations of health-related quality of life measures. You have standardized measures versus individually assigned values to quality of life, length of multiple item questionnaires, interpretation of health-related quality of life scores, and the final thoughts. With regards to assessing health outcomes in health promotion interventions, can we use health-related quality of life or oral health-related quality of life measures? which ones will be more appropriate? In which context do we use them? And for conclusions, no single instrument can be regarded as a standard comprehensive instrument for measurement of oral health-related quality of life. There will always be a need for both generic and more diseases or condition-specific instruments. Characteristics of a good instrument may differ for group comparison for public health purposes compared to measurement of within subject changes. Okay, thank you, ladies and gentlemen.